Most men have heard of Kegel exercises, but few actually know how to isolate and control the specific muscles required to see results. In this guide, we will locate your pelvic floor muscles, complete a perfect 10 repetition set together in real time, and establish a clear daily routine. Strengthening this muscle group leads to improved bladder control, stronger erections, increased sexual stamina, and the elimination of post-urination dribble. However, check these prerequisites. If you experience pelvic pain, painful erections, chronic constipation, or a constant urge to urinate, consult a doctor before starting. These are signs of an overly tight pelvic floor, which strengthening could worsen. For everyone else, executing this exercise correctly provides a targeted, zero-equipment method to improve major urological and sexual outcomes. Your pelvic floor is a literal hammock of muscles, spanning from the pubic bone to the tailbone. To engage it, try visualizing stopping the flow of urine or lifting your penis without touching it. That internal lift is the exact target. You can verify this with a physical self-test. Place 2 fingers on your perineum, the area just behind the testicles, and attempt the flex. You should feel a subtle internal lift or tightening directly under your fingers. It is a small, deep sensation rather than a large physical shift. Look at these common mistakes. If your abs tighten, your thighs flex, or your glutes clench, you are activating the wrong muscles and missing the target area. A strict warning: do not make a habit of practicing this while urinating. Doing so can disrupt your normal bladder function and lead to complications. Pinpointing the specific perineum flex is the essential first step to ensure you are building pelvic strength rather than simply clenching external muscles. Let's move into the beginner baseline position. Lie flat on your back with your knees bent and your feet flat on the floor. This posture removes gravity from the equation, making it easier to isolate the pelvic floor if the muscles are currently weak. We will use a light switch technique, a crisp, intentional on flex, followed by a complete off relaxation, while keeping your breathing steady. Follow the meter for our first reps. Breathe in, breathe out. Gently contract. Hold for 1 second, and relax. Moving through reps 4 to 7, keep the oxygen flowing. For the final reps, completely releasing tension is vital for growth. Completing this coordinated 10-rep set establishes the foundational neuromuscular connection you need to build lasting strength. Your starter routine is simple: 10 repetitions in the morning, 10 in the afternoon, and 10 at night. This totals just 30 repetitions per day, fitting easily into any schedule. As you get stronger, follow this progression chart. Increase your holds from 3 seconds, eventually working up to a full 10-second contraction. You should also advance your posture from lying down to sitting and finally standing as your control improves. Increasing the hold times and changing your body's angle to fight gravity is the mechanism that forces the pelvic floor to adapt and grow. You have now successfully located the pelvic floor muscle, and you felt the exact sensation of a correct, isolated contraction. Noticeable physiological improvements, like firmer erections and leak prevention, typically require 4 to 12 weeks of consistent daily practice. Remember the golden rule: precision beats intensity. If your abs or glutes start taking over the movement, you are squeezing too hard. Bookmark this video to use as a daily visual pacer until the breathing and rhythm are completely memorized. Regular, precise, low-intensity training of this muscle group is a practical, gym-free method for maintaining long-term male urological and sexual function.